Hi, everybody. Just want to do a Facebook Live real quick. Um, Go over today's data. Uh, Unfortunately, we lost two members of the community over the last 24 hours. Females, 79 years of age and 53 years of age. So certainly want to think about them and their families and everybody in the COVID pandemic that we've lost and everybody who's been impacted by this. Um, it's just very sad. And these aren't strangers to many of us. Um, Looking at new cases, we have 110 new cases today, Thursday, Friday, Saturday, usually the big case days. 110 is a pretty good number. 7-day average, 1.6%. So it continues to be at the low end of where we've been in 2021. And so that is good news. Hospital numbers, pretty good shape here. 96 residents in the hospital. First time we've been under 100 in a while. Certainly want to congratulate and thank all of our hospitals for the great work that they're doing and all of the employees and frontline heroes working there. 18 of our neighbors are in the ICU. Please continue to keep them in your thoughts and prayers so that they can get better and get home to their families. Looking at a couple big number, active cases. Our active cases are down to 746. Again, in the beginning of January, we were over 6,000. This is just a big turnaround, big comeback. So we're very happy about that. Looking at some total vaccination numbers for the county going into today, not counting our long-term care facilities, which we're estimating between probably around 6,000 to 7,000 shots were given to senior residents and staff, maybe a little bit more. We don't have the exact numbers, but first doses in Onondaga County going into today was 61,143. That is 13.24% of our population and 17% of the adult population, for which right now those are the only categories we can vaccinate in. So about 17% of the adult population done right now. The average is under 10% in New York State. So we're doing a very good job vaccinating quickly, and we will continue to do that as we get supply. Just wanted to just review a couple things related to vaccine. Remember, a vaccine week is Wednesday to Wednesday for a new week. We get alerted over the weekend what our supply will be for next week. We then will set up clinics. We continue to give second shots as well. And so we think we know what we're going to get for our regular supply. It's been about 1,200 doses a week. We're waiting to see what specific increase we receive for our immunocompromised residents. Yesterday we talked about how we were trying to micro-target in this group. The number of conditions that qualify for the vaccine are quite a few, and that brings in thousands of new people. Just to give you an example, we have 27,000 Onondaga County residents who have diabetes. 1,200 shots, 27,000 people with just diabetes. You can see the challenge. So remember, we've been vaccinating the whole process. Teachers, we've been vaccinating law enforcement officers, healthcare workers, seniors. So many of these individuals have comorbidities as well, and so they've already received a shot. Many in these groups still have not received a shot. So now we have new eligible residents by the tens of thousands, and the new appointments won't be tens of thousands, okay? So we just need to be patient with this. We're going to get to everybody, and our commitment has been that when we have supply, we will get it out. And we've developed and shown as our region and our county is the best in the state. 100% of our vaccine we get in gets in arms in the allotted time. So here's where we were yesterday. We were working with primary care providers to identify their patients who have multiple comorbidities. Why multiple? Because those would be your extreme cases and those who, if they were to get COVID, would have worst case outcomes based off of the data that we have with hospitalizations and loss of life. So that's the strategy. We're working with some of our partners to do that, and some of our partners weren't very comfortable doing that. That's fine. So what we're now going to do is we'll continue to work with the partners who were identifying the multiple comorbidity patients. We'll pre-register those, but we will now open up slots to the public at large who have immunocompromised comorbidities as well next week. And what we will need from you is a doctor's note attesting to your condition for week 1. We're working on new identification allowable forms for week 2 and potentially our own attestation. Again, we get audited by this. We have to make sure that if you say you have a comorbidity and you come to our clinic, that you do. We're responsible for that. We can get fined. So we have to work on our own attestation. Lawyers get involved. They have to make sure that they're comfortable with it. So that will be a week 2 process. So what has changed from yesterday? We have slightly pivoted, as I always, as county executive, hold the right to do. And so what we'll do now is we'll continue to work with the primary care providers that have been actively trying to identify their patients who have multiple comorbidities. We'll work with them on getting pre-registered. Again, all of this is based off of how much supply we get. But in addition to that, we will open up some slots in the typical registration process as well for immunocompromised individuals to go and try to register for as when the slot goes live. So that's the change. With that, when you come, you will need a doctor's note again for week 1. Week 2, we will work on more identification. But again, we are not really quite sure what the supply is going to look like for this. We hope it's large. So that's kind of the update related to vaccine. Again, we just caution everybody. We know this is everybody's anxious. We know you've been waiting for your opportunity to get a shot and get the vaccine, to get your life back, get peace of mind. We're going to get to everyone. We just need to understand that we just don't have enough shots right away, and it's probably going to be a 3, 4, 5, 6, 7 week process, and we'll get through everybody. So in the meantime, we need to continue to be smart, avoid the gatherings inside without mask wearing that have driven high cases. Symptomatic spread is a threat. Let's make sure if we have symptoms, we stay home, we get tested, and then we rule out COVID every time. And if we continue to do those 2 things, we'll keep the positivity rate under 2. We might even go lower. So thank you, and we will see everybody on next Tuesday.